Tonight I'm excited, we're going to have a hard hat tour of our new vertical expansion project at Robert Wood Johnson University Hospital, Somerset. We're going to take a walk through and give members of our community, members of our organization, elected officials and other an opportunity to see what this new space is starting to look like.
We are offering an orthopedic state-of-the-art unit, state-of-the-art equipment, a state-of-the-art room, bathrooms, everything will be updated. It will have 35 rooms dedicated to our orthopedic patients.
A vertical expansion is an opportunity to build up. In this case, we've added 76,000 square feet above our emergency department and existing orthopedic and oncology unit. That 76,000 square feet consists of 2 floors, one shelled out for future growth, and the other floor is a combination of orthopedic beds and a rapid decision unit.
Also have a gym on site for the patients to do their physical therapy right here.
As our community grows, the reality is the needs of healthcare grow. And the nice thing about this hospital is that they're growing with it. And all these different needs that come in, whether it be orthopedics or cardiac, the hospital's responding to the needs of the community.
It's key for us to be a hospital that benefits Somerset County and all the vicinity around Somerset and bring world-class healthcare to this county. And it wouldn't be possible if it wasn't for our loyal donors. So a huge, huge thanks to all what they do every single day for us to help make our mission a reality.
When we developed the project, we brought in our staff. We brought in nurses, we brought in physical therapists, environmental service aides, transporters. We brought in our physicians, and we also brought in some former patients to really give us some feedback as to what would be ideal for them.
We do have private rooms, and this will be a big plus for our patients. It will offer privacy, it will offer comfort, a calm and quiet environment.
When this is done, we're going to have the ability to go back and privatize some other areas of our hospital. At the end of this project, we anticipate having 67% of our rooms totally private. We are anticipating this project to finish in the fall, and we expect to have our first patients in this new space either right before or right after the turn of the calendar year.